Hey, are you afraid to laugh or sneeze for fear of peeing your pants? The good news is that today on the podcast, we've got some answers for you. I'm sitting down with Josie Astley. She's the co-owner of Concept Fit here in Calgary. She's a mother of three and a physiotherapist specializing in pelvic floor health. And you're going to learn all about what your pelvic floor is and how you can strengthen it so that you don't pee your pants next time you sneeze. And before we dive in, let's give a shout out to Victoria Karen. Thanks for being a listener. Now let's dive in.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Allie Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey. Josie, thank you for joining us on the podcast.
Yes, thank you for having me.
And a side note, Josie and I have known each other for many years back in the day, pre-children for you, when I was doing CrossFit, and you're a CrossFit giant back in the day.
Yeah.
So you were always an inspiration to me. I always felt like I was just barely trying to do some of the skills, and you guys were just doing everything around me. But it was fun times.
It was a great chapter. Yeah.
Yeah. And, I like how when we were talking before we started recording, you started to talk about season. This is a good season. Mm-hmm. And I think that's really important for people to consider when you look at your life, that life changes. And if you're not in a good season, then,
Yep. It's totally. And if it's been a good season and it's time for that to wrap up so you can welcome something new, I mean, you should just be brave enough to do it, because we're just supposed to evolve with life and movement. So you just want to go head first into it.
Yeah, exactly. And, you are a physiotherapist. You do focus a lot on pelvic floor health, and we are the Girls Talk Healthy Aging podcast. So we all have pelvic floors, and we probably all can benefit from some more education in this area. So what exactly is the pelvic floor? Can you tell us, and why is it so important for overall health, not just for giving birth, not just for sexual health, but tell us all about it.
Yeah, I know. It's the best first question to ask. So your pelvic floor, I'm going to use my hands here as you have a visualization, but think of a hammock at the base of your pelvis. And this hammock is made up of muscles and tissues and just connective tissue. And this hammock serves a role for women in kind of supporting three main organs. We have our bladder, our uterus, and our rectum. And so it kind of all sits amongst this hammock. So a lot of the purpose of this hammock is support, right? To kind of support those organs up in our pelvic cavity. There's sphincter control. So when we talk about bladder and bowel function, wanting to control the urge to have to go pee or pass gas, we're just going to dive into it. That's sphincter control. Those are muscles. And the pelvic floor system is so important for, I feel everyone, especially women, to be feeling a bit more confident in their knowledge about their own pelvic floor, because it is not just about supporting the organs. It's not just sphincter control. Absolutely there's sexual function in terms of its purpose through there, but it has a role with supporting our core. It has a role with supporting our low back. So, low back pain will really highlight how important it is to look at your pelvic floor. And really, this sling plays a huge role in working as a whole function through kind of this abdominal region, pressure management. And as you go through seasons of life, you've mentioned it, the pregnancy, post-childbirth season, there's a huge emphasis in understanding, make sure you devote time to your pelvic floor, learning, training it, healing it. But there's also a group where, depending on your own personal goal, if you have goals of running, if you have goals of lifting heavy, if you are perimenopause and you're just starting with some hormonal changes, those are still areas where your pelvic floor is really important. It can be impacted by too much of one thing. If you're just a constant trail runner, It can be impacted by those hormones. So it's a system of muscles, but it taps into a lot of individual goals, with back pain, pelvic pain, and just if you're like, I want to make sure I prevent issues in the future, whether it's leakage or heaviness, I want to encourage like all women to be familiar with their pelvic floor.
And I think maybe you can correct me, but I think a lot of people associate pelvic floor work with just pregnancy, and they think, well, I've never had children, so I'm not going to have issues with my pelvic floor. But would that be incorrect thinking?
Yes. Yeah. Like, I will like commonly see patients come in and maybe they even haven't had a child, or they're not even perimenopause, or they're just kind of in this middle ground, but they are still dealing with pelvic floor symptoms, whether it's leakage or pain with sexual intercourse or just feeling uncomfortable. And that is when sometimes how you do your life, like there can be little habits throughout your day. And it's just like any part of our body. If you do too much of maybe one posture, or you're a chronic leg crosser and you just do it for months, these little things can add up and sometimes create symptoms, which is just your body telling you, hey, look at me, like pay attention to me, whether it's pain or any of the other pelvic floor symptoms like heaviness and leakage. But you really need to make sure we understand that, we all with this female anatomy need to be aware that it can happen to any of us. And when I refer to it can happen, it's just any of us can get symptoms. And even if it's unrelated to pelvic floor, if you're dealing with back pain or hip pain, sometimes your pelvic floor might be a huge part of your rehab plan that you might be missing out on or not really thinking about in terms of paying attention to it.
So what are some of the symptoms that women could be experiencing that could lead you to believe that their pelvic floor might need a bit of attention?
Mm-hmm. So some of the more common ones that are really related to like pelvic floor function is pain. So even if that's like pelvic pain, pain with sexual intercourse, then we have just leakage, right? Like dribbling, or you do a heavy lift, or you cough and sneeze and you want to like cross your legs because you think you're going to have some leakage. And even constipation, right? Like chronic constipation, if that's something that you just live with, but you've never really addressed it, you've just that for me is like, I wonder if there's something pelvic floor related there that can really improve that part of your daily life. Other aspects is like heaviness. So sometimes we can feel like just everything is heavy down there. You want to keep your legs closed a bit more. You just feel like that sling, visually is just sitting lower. That is totally what can happen, whether that's post childbirth or even just in general with perimenopause or just strength and tone. And then the other less common that I'm really excited to like educate women about is low back pain, pelvic pain, like SI joint pain. If you feel like you're struggling with inner core activation, you're like, I don't even know if I'm strengthening in my dead bug well enough. That is all your pelvic floor, because it works with your diaphragm. It works with that inner unit through the front of our tummy, underneath our abs. So these are all symptoms that your body's like, hello, I think we should take a look at our pelvic floor.
And what are some of the myths surrounding like pelvic floor, how to strengthen the pelvic floor? Because, all you hear about is Kegels. Oh, just do Kegels and you'll be fine. What other myths are out there that you'd like to dispel?
Yeah, like you've hit it, like the Kegel, that's just a term we use for when you try to just tighten everything up down there, a big full contraction. It's absolutely a myth. It should not be the only thing women do. And sometimes it's actually making the problem worse if you just work on Kegels. You can think of your pelvic floor. We want a really healthy amount of resting tone in our pelvic floor. And if that tone in the muscle is already really tight on resting, and you cough and sneeze, and there should be a nice reflex reaction to that increased abdominal pressure. But if it's already tight, it actually has no ability to like have that sphincter closure. So that's where, like, if you think about you're in that state, is sitting at a stoplight, constantly working on your Kegels going to improve that control? It'll probably just feed into that habit and that tone through that system. So this is when like, no, let's do the opposite. Like, let's get that pelvic floor relaxed and let's help you be familiar with what it means to have pelvic floor that's much more open, so that when you do need that contraction, it's got a full contraction of stability. So the just do Kegels is totally like one of the top like myths that we're as pelvic floor physios and just excited to educate anyone about, because you might be just hindering versus actually really promoting a better health and function.
Yeah, and it's interesting, as you say that, because, my babies and like yours are full adults. And I think about when I went home from the hospital, like I had no education related to pelvic floor other than like just do some Kegels. And that's what I did. And having had your third child like less than a year ago, I mean, you have the knowledge, but do you feel that women are being prepared, being sent home with their baby with appropriate information on pelvic floor health?
It's better. It's better than it once was. It could still be, I know, it could still be miles better, because I think women are just finding different avenues of becoming more aware of how do I support my body postpartum. So I don't know if I feel confident that it's coming square one from the postpartum ward in the hospital. I think we're really focused there, maybe more on the other aspects of helping baby and mom cope postpartum. So I wish there was more pelvic floor education from that point. But I just think that's where other professionals are stepping in with platforms and resources and making it more education. And then you have communities where like women are now talking about it, instead of like rallying behind all peeing together with jumping in a fitness center. Like, that's the other kind of gentle myth is like, it's not normal to have leakage or dribbling or pain. It's not a normal part of aging. It's not a normal part and side effect of having kids. And like, I'm pleased to see there's a change in that. So instead we're saying, no, like I do have this symptom and I think I'm going to get help. So yeah, like I'm excited about the change, and I think it's a slow shift. It must just be the way it is. This is such a big group and a big population to like create big impact. But moments like this is huge. Just like informing everyone like what isn't normal and what is normal, and like go ask for help.
Well, I think the problem is we normalize what shouldn't be normalized, like the leakage. And, I think of women in my demographic, clients, many of my clients, it's just, my question would be, can you jump without leakage? And most would say no, because, they look at me like, well, of course I can't, because nobody can. And so part of the problem is that it is normalized, that, this is just part of aging. So why what are the changes to the pelvic floor, say with hormones, and that would lead women to believe that, oh, well, this is just, I just have to accept this.
Yeah. Yes. Yeah. So like the biggest hormonal change kind of that women will first go through, aside from childbirth and being pregnant, is kind of that perimenopausal season where the body starts kind of having that slow decline in estrogen. So that change in general can impact your pelvic floor musculature. So like you just have, a little bit less elasticity, a little bit less tone, just simply because hormones are changing. Even just like hydration of muscles and tissues down there changes. There's less secretions, there's more dryness, and all of those, even just those little factors can all of a sudden change how your pelvic floor functions. And it can be more common than not to start feeling some pelvic floor related changes as you go through kind of perimenopause, because that's the first change for your body with having that decline in estrogen. So that's when, when we're, and at the same time, we have a bit of a reduced muscle mass. Like that's just the start of it for women a little bit more with the hormones. So there's even more importance to keep up the full body strength, because that is really important for pelvic floor, and then vice versa. And there's a lot that you can do with your pelvic floor, because we can't change perimenopause, we can't change hormonal changes, and we can't change aging, but you can absolutely change what happens to those muscles in that season of life. And that's kind of becoming an expert of your own body. So it's becoming an expert of, where is your pelvic floor strength at? You know, if you go into perimenopause with more body strength, more muscular tone, you will handle likely perimenopause better from a full body standpoint, even from a bone density standpoint. Same for pelvic floor. If we go into perimenopause, or even if you're in the thick of it, or even if you're in menopause, you can still stimulate the pelvic floor. Maybe it's a particular strengthening exercise that has the right visualization for you, and you work on it, and you know the right hip mobility drills to create a nice relaxed tone, and you know how to train it in single leg stance, because most of life is in single leg, from walking to stairs to hiking, like all of it. And so then next thing you know, you have a little exercise program or a couple drills that you do in that season, and you can improve a lot of those symptoms that is not a normal part of those seasons of life.
And that's such good news, because I think a lot of women tend to think that I might just have to have surgery or something like that, because, you know, that's scary. And if this leakage is, you know, normal, then, you know, they're kind of afraid to pursue it, or it's kind of a private subject too that they might not want to bring up with their doctor. So it's good news that, and makes sense that the pelvic floor is just muscle. And it's like your bicep. You work your bicep gets stronger.
Yeah. And like, and posture has, you know, like I feel like I just touched base on like the pelvic floor and what would we do if we were symptomatic with the pelvic floor. But oh my goodness, if we're dealing with leakage or heaviness or any of those common symptoms, postural education and pressure control, like abdominal pressure control, is so important for managing and reducing your symptoms. So for example, like leakage with impact, leakage with coughing, with sneezing, your dog is like pulling at the leash and you're like having to have a quick response, and you like, oh, I just leaked. Like all of that is a quick pressure change from within our abdomen. And if we're not engaging our core well, or you don't have the right strength from below, the increased pressure from within is going to push against the area of least resistance. So maybe it's the pelvic floor. So the pressure is just going straight down. But what if you got really familiar with how to manage those increased pressures when you did cough and sneeze, or you had a cold, or you knew how to jog after your kid 5 steps the right way? If you manage those pressures, then you can actually create the pressures going like in all directions and not just down. And it's the same with our core, right? Like if we're dealing with low back pain, but you don't actually have really confident knowledge and strength on like quality postural core control, then the pressure is going to just hinge into the back or in through the front towards where there's least resistance. So I hope that's like an exciting visualization, because it just shows you how if you get really confident with kind of that lower pelvic, low back control, you can improve your symptoms just by being better managing of your pressures, so that you're not just keep like poking the bear. You don't just keep sending pressures down against a weak floor. Like, let's correct the pressure direction, and then with that time, build that strength. And that's when women that maybe are thinking, I need surgery, are like, that, like, I don't need surgery. This is all I needed to take control of my symptoms, become an expert with what I'm doing in my day and my sitting posture at work. Then I've got my drills, and you kind of tackle it from a couple angles. And it's really impactful.
So let's manage expectations for the listener that is saying, wow, you know, Josie is really speaking my language in terms of like, you know, everything's coming out. How much time does this listener need to invest? I kind of want to point out that it's not like running a marathon. They're not probably big things, but they're small things over time and drills. So talk to me about a little bit about how long do you have to do the work? You know, is it hot and sweaty work? Like, tell us a little bit about.
Yeah, my gosh, it's probably like 6 to 7 minutes, 5 times a week, you know, and then and maybe the first few weeks you're having to spend a bit more time on like postural awareness. Like you're just like because it's new. Maybe that's like your sitting posture, or if you lift with a lot of low back extension, like maybe there's a steep learning curve, and then your weekly mental devotion is a little bit settled down, but it's not a ton. Like, it's quality over quantity with pelvic floor always. So this is when I don't usually prescribe drills at the stoplight. Just get them in. Like, just don't bother doing them at all. Like, find that time, whether it's 4 minutes at the end of your night, you're by yourself. You can just devote that time, whether it's stretching or breath work or some really intentional pelvic floor visualization activation drills. And then there's an element of like lifestyle habits, like daily habits that sometimes we don't realize are as impactful as it is. And when we get some of those things going in our life, and you just start changing how you're sitting on the toilet, or like the foods you're eating, the water you're drinking, I feel like it's a waterfall effect of improvement. So I think like anything, if you're trying to create a new way of doing something, it's a bit more challenging mentally initially, because you're just going against the grain of your everyday routine. But it's not a ton of work. It's just the quality and making time for yourself.
Yeah, and I think that's what I wanted to point out, that for what is seemingly a minimal investment, when you think about this as exercise, it's not like you have to put your gym shoe, your workout gear on and your shoes on and have special equipment and certain space or go somewhere. It's like kind of like a do anything anywhere and a quality 5 minutes over like an hour of hot sweatiness. I just want to kind of make it known that the barrier to entry for improved pelvic health is very low for the benefit.
Yeah. And it's life-changing benefit. I think if I'm speaking to someone that's been there, like had symptoms, like, and you are nervous to go for that 30-minute walk, you're nervous to say yes to a hike with a friend because you just don't know if you have the function or the pelvic floor strength or the fitness to do it. And even just nervous to be in a group setting because you might just have some leakage. So like you don't realize how important pelvic floor function is until you've experienced maybe having some symptoms, a low back pain that's chronically sore, and you've seen a physio, you've seen a chiro and a massage, and it's not getting better. And you don't think about your pelvic floor at all until symptoms are there, until something's telling you, pay attention. And it can create a lot of reduced confidence. You can create a small world because you're nervous to say yes to the bigger thing, the longer walk, the group setting. But when you intercept that and like start improving those symptoms, it's so neat how it opens up the door to confidence, like, and saying yes to more movement and more experiences. So you're right. It's like the smallest, least invasive, low cost investment for potentially like a life-changing improvement.
Yeah. And I think that sometimes with women that I've had experience with is that they don't even realize the impact of how this issue is making the world smaller, because they don't want to do 18 holes of golf because there's no restrooms on the course. Or like you said, they don't want to be in a setting where they don't have control. And so this small amount of work can change that. And it doesn't have to be a surgical intervention, which I think is so exciting because it's very empowering. I wanted to ask a little bit, when we were talking about hormone changes, would vaginal estrogen have a positive effect on pelvic floor health?
Yeah. In some patients, it's an appropriate treatment. Because, if we're dealing with hormone related pelvic floor changes, and like a low dose support there can improve that, amazing. Sometimes it's important to remember that shouldn't be the only thing you do. Like that's part of your plan. You should also be working on the postural changes you need, and the pressure management knowledge, and your daily habits that might be causing pressure changes or irritation or making things worse, adding this right drills. So I want people to think like they should be thinking they're doing a multitude of things to support themselves, not just one thing.
Yeah, I don't want it to be like, oh, I'm just going to do vaginal estrogen and that's the Band-Aid. That is a part of the whole picture. I know that it does address bladder urgency, and one of the OBGYNs, Dr. Ardell Piper, her wish at the end of her podcast was that every woman should be on vaginal estrogen, you know, during perimenopause and beyond. So I do want to highlight that could help. So thank you for confirming, but that is definitely not the only thing that we should be looking at.
Especially like when you mentioned the bladder, like something that I find so fascinating is, you know, the bladder, you can train your bladder. And so, you know, one of the things that comes to mind, you know, if we're dealing with urgency, so you're just like, oh my gosh, I have to go to the bathroom and I have to go right now or else I'm going to have an accident. You know, that's kind of what urgency is. And sometimes what can happen is we get into the habit of doing a lot of just in case pees. Yeah. So like before you finished work, you close your laptop and you're like, I'm just going to go do a quick pee before I get in the road in case there's traffic or in case it's a longer drive and I don't make it, and I'm going to have a workout. I'm going to go pee just in case. So totally there's a time and a place for that. But if you're doing too many just in case pees, your like central nervous system is training your bladder to not have that ability to relax and open up and create more space for more volume of urine. And so that's when, like, we talk about daily habits. You know, I'll get a diary log of how when someone's going pee and the frequency and the timing, and we can work on that to see if there's a lot of just in case pees happen, because the power of just trying every once in a while to ignore the first urge and say, okay, I'm going to ignore that urge and go in 5 minutes, or I'm going to just go in 2 minutes. My next urge, I'll honor it and I'll go. But if you ignore the first urge, your body's like, okay, Josie's ignored the urge. I'm going to cause a reflex reaction of all, like my bladder, it's going to expand and create more space. So then there's less urgency. But if you do too many just in case pees, you down train that reflex. There's never an opportunity for that to happen. So you end up with like just a smaller, more hyperactive bladder. Yeah. So, you know, that's when, like, as a pelvic floor physio, I get so excited about just educating individuals about daily habits, because
wow, talk about quality of life improvement for the listener that, you know, does a just in case pee 10 times a day.
Mm-hmm. And like, don't all of a sudden stop them. Just find like safe little windows initially to say,
yes,
no, I think I need to go and relax, and then try to go on the second urge and just work on it. And that can be a life-changing habit that someone's like, I never thought of that, and it's impacting a lot.
And I also, I've heard some talk and regarding when someone knows that they won't be able to go to the bathroom for a long time, that they choose not to drink because they think, well, if I don't drink, I won't have to pee. But totally. I think that's also counter.
Yeah. So, you know, when we talk about bladder irritation, really concentrated urine is a bladder irritant. So if you don't drink enough water and your urine's really concentrated, your bladder is going to get irritated and tell you it needs to go. So it does not help the situation. You're better off finding ways to gently hydrate yourself throughout the day, because then you don't have that concentrated urine that's going to be a bladder irritant.
Yeah. Yeah. So again, just dispelling a few of these myths can really, and helping with those bathroom habits. What about pooping habits? You know, I mean, like, I think a problem will be like just sitting and scrolling on the toilet for a long time. Give us some direction on pooping habits.
Yeah, like, and this is kind of that constipation, right? Like, and constipation is more than just you're backed up for 4 days, you didn't have a bowel movement. You know, the firmness of stool, your like comfort with being able to fully empty, or feeling like, I think there's still a little bit there. So, you know, when we talk about constipation, your pelvic floor can be so tight, it's not creating that nice relaxed environment to open and like release the stool. Stool can be too firm. So like, that's when just general knowledge about your water intake and fibrous foods can be helpful. And then like a squatty potty, right? So that's like a little stool that helps you put your feet on it when you're sat at the toilet. So your knees are higher than your hips. And if you think about before we had toilets and before we had houses, we were squatted down in that position to relieve ourselves. And like that is the best pelvic angle for our rectum and for our body to pass stool comfortably. Without putting too much strain. Like we really don't want to spend every bowel movement holding our breath and bearing down and straining. It's really hard on our pelvic floor. So that's where a squatty potty is like our way of meeting modern day toilets with the right position that can create a lot of relief and support. And if you've been dealing with kind of like chronic constipation where you're just living with it and it's just the way you do it, honestly, pelvic floor physiotherapy can be really eye-opening.
Yeah.
To understand where your habits are at personally and kind of what are your first few steps. Because if it is urgency or leakage, it can be really overwhelming to know where to start. And it is very personalized to know,
It's hard for women to talk about this. I know that with my clients, we do talk about bathroom habits, and I've just been so enlightened now about constipation that it's like, oh, I need to be talking about physio or like pelvic floor health with like clients that are experiencing chronic constipation, because I'm dealing with it from a movement, hydration, nutrition standpoint. But man, if we could also hit it with some pelvic floor help, getting some help in that direction.
And I think it's important for like everyone to understand like pelvic floor physiotherapy has a huge educational component. Like if you book that appointment and you're sat down with, there's a huge educational component. There's a like external assessment where we're looking at posture and movement and how do you engage your core? How are you breathing? How do you lunge and squat? Like whatever is relevant for the individual's goals. But there's another part where there is an internal exam where, and that's the only way, if you think about this sling, if we're going to understand your tone and your strength and your habits and tendencies, that's the internal exam that sometimes is a little bit nerve-wracking, or that's when a bit of a barrier, someone's a bit nervous for that exam because it's an internal exam. But that can be what we need to understand like where your pelvic floor is at. And it's also a great chance for the patient to understand their own pelvic floor, because they're getting tactile feedback right then and there about how to work and understand. So I think there's a huge component in like education, and posture has a huge weight, but that internal exam or just that personal exam can be kind of the gold standard of like the first point to say, okay, what do I do? What's my first starting point?
Well, and having said that, you say that it's the gold standard, but it's not the, hi, I'm Josie, and take down your pants. Like there's a lot of trust built before you get to that.
Yeah. And
I ease anyone's, apprehension.
And I want to encourage like everyone, if you're not comfortable with that, don't not see your pelvic floor physiotherapist. Go still book it in and tell them I'm not ready for my internal exam, but help me as much as you can. And maybe we can work towards it. And that's where I think so much improvement could be made if we still go see our pelvic floor physiotherapist, but being comfortable with explaining your comforts and your nervousness and knowing that the pelvic floor physiotherapist, we can all meet you where you're at and still provide as much support with where, because we'd rather you come in, get the education, help you as much as possible and work towards it.
Yeah. And go from there.
Yeah.
So, I'm going to ask kind of a personal question that I'm working with a client who's hypermobile, and like in kind of all her joints, and yet she has a lot of hip pain. And so I'm wondering if this is related to pelvic floor, and maybe I'm just going to send her to you, which we're going to talk about shortly, of how you work with women. But what could I be doing with this specific client to help her with her tight hips?
Yeah, is it tightness because a muscle's short? Is it tight because the resting tone is just tighter than what it normally is? And this is where, is it habitual tone? It's just, there's been so much loosey-goosey movement. The hips don't know what to do, but go into like brace necked position and just holding. So it's kind of.
I think that's pretty much what it is. And so is that something that you could be working with to help her with?
Yeah. Yeah. Like
I want to be helping her, strengthen other areas of her body, but she is limited by these tight hips and lower back. And I'm thinking, I think this is all related to pelvic floor. So
yeah. And when we think of your pelvic floor, we have some hip internal rotating muscles that are all associated with your pelvic floor. It's all really close beside each other, right? Your pelvic floor goes to your tailbone and it comes to your hip bones. And you just think about that and where your hip joints sit. So it would be important to see how that pelvic floor is functioning on its own. How does it work with hips? And then going outside the box and be like, well, what are we doing with our daily habits and our postures? Like, tell me the pain pattern. When's it worse? And then you can kind of see it from a different perspective, more of a pelvic floor standpoint, and see if there's some like habitual loops we need to intercept and change that kind of breaks. I like to say, like, it breaks a cycle of just tone and guard and tension and muscles and joints feeling threatened when there's technically no threat, but they just have that habit because it's just felt.
Yeah. She's just holding it together.
Yeah.
I feel like that's, and so you're the expert on pelvic floor health. I can help her with strength in other areas, but I thought, and that was one of the reasons I wanted you on the podcast, Josie. Yeah. I need to help this person.
Yeah. And it's so great to do that, right? Refer to the specialty. Even for myself, if I know there's another pelvic floor physio this is their niche, let's not waste time. Like, go see that. They've spent another 10 years in that department. Go see them. Yeah. And then I love the idea of professionals and supports communicating with each other. So it's just, okay, Shawna, this is what we need to be doing more of, less of. Let's do that for 3 weeks. Then let's revisit. I think that's all we can ask for ourselves and our family. And for those we work with, is that we do have that world where our professionals are kind of multidisciplinary and interchanging and supporting.
Yeah. Collaboration is really the best, because I don't want to claim that I have all the answers because I don't. And so that's why I'm looking for other answers.
Yeah, totally. Likewise.
Yeah. So that will be a referral that I make. So, what are a few simple habits that our listener can, whether our listeners have pelvic floor issues or not, what can we be doing at home to improve our pelvic floor health?
Yeah, love that question. Breathing. So, quality breath work, because our pelvic floor is supposed to be working with our diaphragm. And if we're shoulder breathers, or we're not spending time, even just the majority of us are living in a fast-paced, high demanding, relatively stressed routine. I'm going to say the majority of our days are in that buzzing energy. That changes how we're breathing. So that's going to change how your pelvic floor is functioning and how your core works. And so if you can spend 5 minutes, every other day, every day, where you're just working on some diaphragmatic breath work, quality expansion, feeling the belly expand through, we should all be doing that to prevent pelvic floor, symptoms, to support our pelvic floor current symptoms. That's a great, easy habit. And the second one is, sorry.
I just want to go back to, can you explain to our listeners what you mean by diaphragmatic breathing?
Yeah.
Because that might not be understood.
Yeah. So let's say my exercise for you is today, take a minute or 2 minutes. And I would prefer if you're laying down on your bed, knees bent, feet flat. And I like to have hands just on your rib cage or on your belly, wherever you want to focus on some good expansion. And it's breathing in through your nose and feeling the air within your abdomen expand outwards through our belly. Think 360 degrees. And you breathe in and then breathe out through your mouth. And you're being very intent. You're focused, you're visualizing, and you're just breathing and getting that really good quality expansion. Instead of what might be happening is we're just breathing up into our traps and our shoulders. So when you do that 360 degree breathing, that diaphragm actually moves more. and it moves the way we want it to. And when it moves up, then your pelvic floor gets a nice, like, synchronized lift with it. That's a really important part of how we want our inner core system to work. And if we don't do some of that quality breathing, then we don't have that diaphragm moving really well.
Yeah. Okay. Thank you for clarifying that.
Yeah.
And now your second point.
Oh yeah. So like get a squatty potty, or like use a kid's stool if you have it. Like it's just so helpful to eliminate, extra downward pressure because you've optimized the pelvic angle. So that's a great daily habit. The third one is like just hydrating, fibrous foods. Those things really help with basically having quality urine, like nothing too concentrated, and your stool soft and good to go. And then the last is like, and this is where like my pelvic floor physio hat and my personal training hat merge, and I'm just move. Like pelvic floor loves strength training. It like loves it. Like it's so healthy to lift weight and do a carry and have that downward pressure. So you learn to control with core. So you do the hard things in the gym, you have variety in the gym, so that when you go lift your milk jug, it is easy and your pelvic floor can totally handle that because you've done 25 pounds in the gym and that jug's 5.
Yeah.
So,
Yeah.
and like, I think with that, your body needs variety. Too much of one thing isn't great. So if you are a runner and you're running and the only thing you do is run, but you haven't moved laterally or done something in a different plane, it's hard on your body, even though if running and exercise is great. So just make sure in your week you do have variety, and it goes down to your 30-minute walk. If you walk the same route at lunch, do it in reverse or do it with a different speed, like just something. It's so important for your brain and your body to have that variety, and it feeds into a lot more, right down to pelvic floor function, to back, to just how you feel, how your body's doing.
Yeah, and I think that people forget that we're meant to move.
Mm-hmm.
So, and we are meant to move in a variety of planes. So that is good advice to, swap up your walking route, walk backwards, or, I mean, only when it's safe, but like just change things up.
Totally.
Your tempo, your gait, your, because if you're always going uphill or downhill at the same point in the walk, that can also, when you're going uphill at the beginning or downhill at the beginning, like that can change things.
Yes,
so benefits from that.
Yeah, and we live in a busy world. Like we're all busy, and if you're thinking like, how am I supposed to remember to do all these things? And like this is where having an online coach, a personal trainer can take that on for you. You know what I mean? Can give you the variety, encourage you the things you need to do. And this is where the pelvic floor physio can say, this is your first step. Don't worry about this other stuff we need to work on. Start here. So that's when, don't let being overwhelmed stop you from saying yes or asking for help, and just find someone to like take that on for you. And that's just making that time to like book that appointment or reach out and say, I'm ready.
Yeah, because sometimes it is overwhelming and you don't know where to start. And you've mentioned a lot of things, but all those things might not be appropriate for one person. And so having that, Allie and I are huge advocates of having a coach, because that is the coach does the heavy lifting. Okay, this week you're going to work on this and this. Okay, now we're going to progress you to this next step. So tell us a little bit about how someone could get to work with you. I know you're in Calgary, but that shouldn't be a limiting factor for our listeners that aren't in Calgary. Tell us more.
Yeah. So, like a big part of my business is online. So I can help online from a pelvic floor physio standpoint, or from just like a woman's coach that's really specializing in that. So in terms of asking, how do I work with Josie, or how do I just get help? Email me, just like literally email me at josie@conceptfit.ca. That's a great first small step to be me either helping you or sending you the right direction wherever you are. Yeah. And the other thing is like ask around. Like if you are curious about pelvic floor physiotherapy and maybe you're not in Calgary, or the best first place to start is just to ask family and friends if they've had a positive experience or they know someone, so you already feel a little bit more comfortable with having a bit of a referral. So that's like, I would rather you see someone than nothing, no one at all. And asking your community and kind of some trusted friends is a great first place. And then you can also just find me on Instagram. I try to send some education and like inspiration into the world through that platform, which we can kind of attach my username for that. But
yeah, we'll have all your contact information in the show notes. And to our listeners, like, I would advocate for working with you, Josie, because I've known you for years, and you just put out good content, evidence-based. So I think it's really important that a person finds somebody qualified, and know that it's not, when you reach out for help, it's not that, hey, I need to work with Josie for the rest of my life. It's an intervention for better quality for the rest of your life.
Totally. One piece of your journey, one first step, and maybe it's the first step's the biggest one you take, because it's finally saying, I'm going to make time for it.
Can
but
change
it's amazing.
The trajectory.
Yes, totally. And it's like, I did it. Like I'm putting myself first finally.
Yeah.
And that's powerful to just do. So
yeah. Did I miss anything in terms of, like, is there anything else that women really need to know about pelvic floor? Or have we kind of covered the high points?
I feel like we've done a good job covering a lot of the key, like, relevant, important aspects. I just want anyone that's like curious, like, I'm dealing with symptoms, or maybe I'm not dealing with symptoms, but I'm curious about my pelvic floor. Just go ask for help, email me, see a pelvic floor physiotherapist that's with referral, because education is part of giving yourself confidence. And that's just easy to just know and learn and be curious and take it on. So I think as we go through the aging process from 30 on, like, if we can just be educated and informed, then you can kind of be ahead of the game and have confidence through all the seasons that are expected or unexpected. And like, life's busy, but there's not probably going to be an ideal time for you to book the appointment or to do the email. You just got to do it. So I think we're all in it. Like, you have to prioritize your health sometimes.
Well, always.
Yeah.
And we always end with a wish for our listeners, but I'm guessing maybe that's your wish, is that people don't wait, and that is exactly my wish too, that let's not normalize leakage and our shrinking world because, I might have to go to the bathroom. We can maybe get some help for that. That is simple and non-surgical. And I encourage women to seek you out, Josie.
Thanks for listening. You'll find me, Allie, on Instagram at Allie Curve Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.